The highly contagious coronavirus strain from Brazil is now in the U.S. Health officials in Minnesota announced the nation's first case on Monday. They say it was found in a patient who traveled to Brazil before becoming ill earlier this month. Officials also announced 2 new cases of the variant from the U.K., bringing the number to 8 infections in Minnesota. The state's health commissioner says the new cases reinforce the need to keep wearing masks and socially distance. Johns Hopkins University is reporting 25.3 million COVID infections in the United States, with more than 421,000 deaths. But there is some good news. The COVID tracking project is reporting 49 states are seeing a decline in cases. Those declining numbers prompted California Governor Gavin Newsom to make the controversial decision to lift his state's stay-at-home orders. Joining us now to talk more about this is Dr. Uché Blackstock. She is a Yahoo News medical contributor and an emergency medicine physician. Doctor, welcome. Great to have you with us.
Thank you.
So California's governor lifted the state's stay-at-home order because of these falling COVID numbers. But on Monday, the Minnesota Health Department announced 2 patients diagnosed with the UK variant, and they had apparently recently traveled to California. So do you think the move to lift COVID restrictions there might be premature? Or how big of an impact could California's decision have on the rest of the country?
Right. And so it remains to be seen. I will say that there were a number of surprised public health experts and colleagues of mine the other day when we heard these restrictions had been lifted, especially since the numbers in California have not been declining for a considerable amount of time. And as we saw in the spring with the reopenings of the states early, that was one of the prime reasons for the second surge that we saw. So again, I think California is going to have to closely monitor its numbers. And I have a feeling that we probably will see some restrictions reimposed in certain parts of the state.
And the COVID tracking project is reporting that most of the U.S. is seeing a decline in coronavirus cases, which is very good news. However, do we know what that is related to? Because we are also seeing these more of the mutations spreading, correct? So is the decline because it appears that people are taking more precautions, or is it because the vaccine rollout that we've seen so far is starting to have an effect? What can we attribute the decline to?
Right. Well, so first, it's definitely not the vaccine, because we've seen some modeling that showed that we need to wear masks and physically distance into the summer to actually see any benefits from the vaccine. I think what we're seeing now in terms of the declining cases and hospitalizations, fortunately, is a result of restrictions in states such as California and other states across the country in terms of mask mandates and physical distancing, and obviously individuals listening to those really important public health measures that we know work so well. So that's why we're seeing this decrease, and we really need people to keep up following these measures, and we also need for states to keep these restrictions in place, because we've really seen the grimmest of the pandemic so far, and the numbers actually could get exponentially worse.
And I want to ask you about your level of concern for these new variants, because some people are very concerned, some people are not as concerned. Moderna is saying that its vaccine is effective against the new COVID strains, but it's still planning to create a booster. If the vaccine is effective, why would we need a booster?
Right. And I will say the variants are concerning. And the reason why we have the variants is because the virus has spread so widely. And as it spreads and as it replicates, the mutations occur. And so, the variant from Brazil and from UK are thought to be more highly transmissible. So I'm more likely to infect someone that's standing next to me. And what the Moderna researchers are doing is the third booster would increase the immunity, because what they saw, especially for the variant from South Africa, is that the vaccine was slightly less effective. However, still incredibly potent and still highly effective. But this third booster may be needed. We'll see as they observe more of their participants in the clinical trials, but it may be needed after the second dose.
All right, well, I'm still waiting for my first. So Dr. Uché Blackstock, thank you so much for joining us. We really appreciate it.
Thank you.